So, good morning. Hi, everyone. Can you start your session? So, we are having a Telegram group. So, the interaction will be on the Telegram group. So, initially, we'll be starting with the topics which you need to write in your notes, class notes. Workbook. You need workbook for day 3 and day 4. So, no need of workbook for day 1 and 2. So, there is nothing to worry. So, workbook, I'll ask them to send it. So, is it audible, everyone? So, I'm discussing with you in the Telegram group. Is it audible, everyone? So, the topics which I teach usually on day 1, 2, and few topics on day 3 also will be in the class notes. So, the first chapter for today is health indicators. So, the first chapter for today is health indicators. So, make chapter heading, write class notes. There are few topics which are factual based topics that we'll be writing in the worksheets only. Remaining all the important conceptual topics should be in the class notes. You should write and understand. Then only the retention part is easier for you to recall in the exams also. Or else what you'll be doing, you'll be forgetting most of the things after reading everything. That should not happen. So the chapter heading is health indicators. So in this first subheading, very basic, what we'll be starting with is the difference between three things. Make short headings. The difference between rate, ratio, and proportion. You should know the basic difference. They'll be asking the properties of rate, ratio, and proportion. So make subheading. So the first thing it is rate. So there are two things in a fraction. There are two parts in a fraction, numerator and denominator. So within rate, numerator is a part of the denominator. So I'll be giving the examples you'll be understanding later. Numerator is a part of the denominator. That means there are two things, numerator and denominator. When you are comparing two things, it is comparison between two same entities or different entities. What is your answer? Comparison between two same entities or different entities? Yes, good. Comparison between two same entities or different entities? Good. Comparison between same entities. But in ratio it will be different entities. So here it is comparison between two same entities. Highlight the keywords. Use the highlighter in the class notes. Workbook you can use it in day 3 and day 4. Workbook topics are very small topics, all miscellaneous topics. Workbook means it is more of factual things what I have put there. All conceptual topics you have to write in the class notes, then only you will understand. If you write everything in workbook, later you will forget everything. I am telling this. That is why. I want output. The amount of input what you are putting, output is more important. Writing everything, forgetting everything, that is not the thing. You should not be restless. Like whatever the input you are putting, you have to get the output. It's more about investment. Rate is an event which changes with respect to time. True statement. So whenever they give an event which changes with respect to time, that is rate. Give some examples for rate if they ask. Give some examples for rate if they are asking. Any event which is changing with respect to time. can increase, decrease with respect to time. So give some examples for rate. There are two examples for rate. Example one is infant mortality rate. Write down this word. Example one is infant mortality rate. So what is the formula for infant mortality rate? In detail, I'll be discussing it in demography chapter also. What is the numerator? Infant deaths. Infants will die. Means within 1 year, how many will die? But we start from the denominator. What is the denominator of infant mortality rate? Reply this in the Telegram group. Yes, good. What is the denominator for infant mortality rate? Comparison between two same entities. You have to keep the same entities. That is why I'm telling. What is the denominator of infant mortality rate? Live births. Good. The denominator will be live births. Multiply with 1000. For every 1000 live births, how many infants will die? For every 1000 live births, how many infants will die? So what is the multiplier for infant mortality rate? Very good. Answer each and every question because it is interactive batch na, means whatever the efforts you are putting, it has to come out in a proper way. You have to recall each and everything in the exams. That is the use of interaction with the teacher, live session. For every 1000 live births, how many infants will die? The recent infant mortality rate is 28 per 1000 live births. The recent infant mortality rate is 28. So infant mortality rate of our country is decreasing every year. It is coming down every year. What can be the reason? Yes, good. Infant mortality rate of our country is decreasing every year. So what can be the reason? Tell me. What can be the reason? Income, yes. Socioeconomic status is improving. We are having so much of money nowadays. Yes, we are investing money. IPL, yes, correct. Don't write Indian Premier League income and all. Just write what I'm telling. If income is better, infant mortality rate will be lesser. Write this next point. If income is increasing, good, infant mortality rate will decrease. If income is more, IMR is less. What type of relationship you see in between them? Positive correlation or negative correlation? Good. Tell me the answer. What type of relationship you will be seeing? Positive correlation or negative correlation? Positive correlation or negative correlation? Negative correlation. Very good. Write this point. In between them, there is negative correlation. Correlation, again, I'll be asking it in statistics part again. These are very basic points which I'm making you to write. Give me two examples for variables which can show negative correlation. Means one is increasing, the other will decrease. Answer is income and infant mortality rate. So tell me one more point. Listen. Infant mortality rate can indicate socio-economic status of a country. Indirectly, I'm telling. Tell me true or false. Infant mortality rate can indicate socio-economic status of a country. Tell me true or false. Yes, good. Infant mortality rate can indicate socio-economic status. True or false? True statement. Write this word. Very important. Infant mortality rate can indicate socio-economic status. Very good. So these points are very important. Correct. Less IMR, very good. Income, very good. Socio-economic status, correct. So these are some basic points in rate. The first example which I gave was infant mortality rate. Again, I'll be discussing how to calculate infant mortality rate, what is the most common cause and all that. Separate chapter will come when I teach maternal and child health. Huh? So now tell me, did you copy all the points which was written here? Tell me yes or no. Did you copy all the points in the notes? Keep a separate 200-page notes. That is very important. Along with that, workbook. Workbook has only miscellaneous topics. I'm not keeping all the topics in workbook. Intentionally, I'm not keeping all the topics in workbook, because if you copy everything in workbook, you'll forget later. I don't want that. I want you to write and learn. You have to show that hunger, dedication, then only something will happen. The second example for rate is incidence. So now tell me, the word incidence will indicate new cases or existing cases. Very easy question I'm asking. The word incidence will indicate new cases or existing cases. New cases. Something will happen in the future. New cases with respect to time. Write the definition properly. New cases with respect to time. So anything which will happen in the future. As of now, there is no case. In the future, some cases will develop. That is incidence. In detail, I'll be discussing later. So incidence is an example for rate or proportion. Tell me. Incidence is an example for rate or proportion. You have to answer each and every question I ask. Then only you'll be retaining everything properly. In the exams during revision, it will be very easy. The subject will become very easy for you later. Yes. Rate. So tell me two examples for rate. Give numbers. Infant mortality rate and incidence. I for infant mortality rate, I for incidence. So there are two examples for rate. So now tell me, when I discuss ratio. Ratio means comparison between two same entities or different entities. Very basic question I'm asking. School level questions I'm asking. Because those are the things which has been asked in the exam. All these are previous year questions only. Whatever we are discussing, PSM, concise, what I'm teaching in MCQ part is always previous year topics, previous year questions. Yes, good. Ratio. Numerator is not a part of the denominator. Comparison between two different entities. Yes, correct. Ratio. Write down this. Comparison between two different entities. A by B, X by Y means there are two different entities. What we'll be comparing. Give some examples for ratio. Tell me the examples. First, write the notes. Aram se. Use highlighter. The only thing which will decide whether you can recall your notes or not is highlighter. I am telling this word directly, because without highlighter, it's very difficult later to select the keywords. Because during exams, it's always about keywords. Revising the keywords. Highlight this. Are you highlighting this? Tell me yes or no. I'm asking one more question, and you touch your heart left side and tell me whether you are highlighting this or not. If you don't have highlighter now, you can bring highlighter in the next session, if not tomorrow, but you have to use highlighters while writing the notes. Class notes is very important. Later, when you are revising the notes, you should feel that, there is something called as feeling, na? अपनापन बोलते हैं ना उसको. Should feel it is mine, that feeling should be there. Highlighter should be there, or else the whole thing will be highlighting later. It will become yellow color. Chennai Super Kings, na? That should not happen. Give me some examples for ratio. Number one, sex ratio. Yes, good. What you're telling is correct. Sex ratio. Number of females. Number of females per 1000 males. Number of females per 1000 males. Write down this definition. Two different entities. Number of females per 1000 males. Later we'll be discussing what is the sex ratio for country when I discuss demography chapter. Here my purpose is just to tell the examples. Now tell me, infant mortality rate, you are comparing two same entities. Infant deaths and live birth, two same entities. But in maternal mortality ratio, what will be comparing? Think and tell. Very easy question I'm asking. Maternal mortality ratio, what will be doing? Yes, good. Two different entities. Yes, correct. Two different entities. How? Because yes, tell me the example, tell me the formula. Numerator is maternal deaths. Okay, sir, good. Denominator will be live birth. Numerator is mother, denominator is live birth. So two different entities what you are comparing. So it is maternal mortality ratio. Yes, very good. Maternal mortality ratio. Yes, very good. Very good, correct. So what is the formula for MMR? Tell me, what is the formula for maternal mortality ratio? Maternal deaths divided by live birth. Two same entities or different entities? Different entities. Multiply with 1 lakh. 1000 if you multiply will get very less value. 1000 if you are multiplying will be getting very less value because infant deaths are usually it will happen, but maternal deaths very less in the hospital. So if you multiply with 1000 you will get the decimal values. It is very less. So what is the multiplier used in maternal mortality ratio for our country? Answer my question. What is the multiplier used in MMR in our country? I am asking. Good. 1 lakh is the multiplier. 1000 you can use, but you'll get very less value. If I multiply with 1000, I'll be getting something like 0.97. That should not happen. We have to use 1 lakh as the multiplier. The recent value was 97. 97 per 1 lakh livers. 97 per 1 lakh livers. Yes, correct. What is the recent maternal mortality ratio of our country? Answer my question. What is the recent maternal mortality ratio of our country? Answer my question. $97. What is the unit? Per 1 lakh live births. Per 1 lakh live births. So this is the recent MMR of our country. So two examples for ratio. Tell me the answer. Now tell me the answer. Two examples for ratio. Number 1, sex ratio. Number 2, maternal mortality ratio. I'll be discussing in detail what are the different causes of MMR, how to reduce MMR, how to calculate MMR. All these things will come in maternal and child health chapter. This is maternal mortality ratio. Two examples which I gave is sex ratio and maternal mortality ratio. Two examples for ratio. Two examples for rate we have finished. What subheading we are discussing? Rate, ratio and proportion. Rate, ratio and proportion. So what is the point which I have to write in proportion? So listen to the words properly. Numerator is a part of the denominator. True or false? Very good. Numerator is a part of the denominator. True or false? True statement. Because whatever you are estimating in proportion, it is the total part, like within the denominator only. Yes, very good. True statement. For true, you can type T because I'll be asking so many true false questions. That is how we retain everything. When you ask your seniors, they'll be telling it's very easy to revise your notes just because the way we have been taught is different. The way we have discussed is different, not just one way. It's always about interaction. True statement. True statement. Yes, numerator is a part of the denominator, but proportion what we do is calculated at one point of time. Calculated at one point of time. Like if I go to a class and if I find how many are having disease at that point of time. If I go to a class now, if I am doing a study and if I estimate how many are having disease at one point of time, what is this? Existing cases. What is this? Incidence or prevalence? Tell me, you know the words. Yes, very easy question. I'm giving all the questions in direct questions I'm asking. Yes, tell me, if you're going to a class and if you are estimating how many are having disease, what is this? Incidence or prevalence? Answer is prevalence. Yes. You can type one letter. Just I want interaction from you, na? So example is prevalence. Just type P. Yes, good. Prevalence means existing cases or new cases. Tell me the answer. Existing cases at one point of time. How many are having disease at one point of time? English word prevalence means present tense. Incidence means future tense. Very easy English. Incidence means something will happen in the future. Prevalence means what is present with us. Simple English. There is nothing in the words like what will happen in the future is incidence. What is there with us it's prevalence. I'll be teaching in detail what study how with the prevalence is related to incidence. All these questions will come. So the first example for proportion is prevalence. Yes, good. The first example for proportion is prevalence. The second example for proportion. If you go to a community, if you are studying, how many are using contraceptives? Is a very easy question I'm asking. If you are going to a community, if you are checking how many are using contraceptives, out of total couples, how many are using contraceptives at that point of time? What indicator you are calculating? Very, very easy question. Tell me good. If you are going to the system community, out of total, if 50% are using contraception. Yes, what is the indicator you are calculating? That is the second example for proportion. That is a second example for proportion. What indicator you are calculating? CPR, very good. Couple protection rate. Very, very good. Couple protection rate. So couple protection rate can indicate proportion of contraceptive practice, true or false. Couple protection rate can indicate proportion of contraceptive practice, true or false. What is your answer? Very good. True statement. Yes, sir, it can indicate percentage proportion of contraceptive practice. Don't make mistake in the exam for these basic questions what they are asking. Proportion of contraceptive practice. Yes, couple protection rate. Again, I will discuss how to calculate this in family planning. What are the different contraceptives we need to consider in couple protection rate? How much we need at least in India to get that replacement level? All these things will come in detail in a different chapter for you. Two examples for proportions. I want everyone to type this now. Yes, I want everyone to type this. Two examples for proportion. So when we are telling live interactive session means I'll be asking questions. I'll be giving time for you to write things. I'll be making you to learn everything in detail. I'll make you to recall things in the exams also. From my side, I'll be giving almost 100%, but I want the same thing from your side also. The way you are interacting in the group is very, very, very good. Yes, correct. Almost. Yes, very good. So two examples for proportions we have finished. So what is the first topic we have finished? Can anyone type the first topic for me? Rate, ratio and proportion. Very good. Rate, ratio and proportion. So we finished this topic now. Put one smiley. So smiley means just one dot like this. Some vibes we have to create, right? Mortality indicators. Next topic. Mortality indicators. Mortality indicators. So there are different mortality indicators what we need to discuss. So the first mortality indicators. The first mortality indicators. There are different mortality indicators what we need to discuss. The first mortality indicator will be life expectancy. So make subheading mortality indicators. Yes, make subheading mortality indicators. In that, write number one is life expectancy. Number one is life expectancy. What is life expectancy if I am asking? Average number of years of life lived. Write this word. Average number of years lived in a country. Average number of years lived in a country. So if I'm using this word, listen to the words properly. Average number of years lived in a country. This will indicate quantity of life or quality of life. For example, I'm telling India male 87. See the words properly. India male 87. Example I'm telling. Average number of years lived in a country. So this will indicate quantity of life or quality of life. Answer my question. This will indicate quantity of life or quality of life. Quantity or quality? Yes, good. Quantity. It's not related to quality. It is always quantity of life. It is always quantity of life. See this word. It is indicating quantity. It is no way related to quality. Keep this in mind. It is nowhere related to quality. So if your health status is good, life expectancy will be more. See the words properly. If your health status is good, life expectancy will be more. Tell me true or false. If your health status is good, life expectancy will be more. This was the question again, indirectly. True statement. That means it can indicate positive health status. Tell me true or false. It can indicate positive health status of a country. True or false. True statement. So life expectancy is a positive health indicator. Write this word. Life expectancy is a positive health indicator. So which of the following mortality indicator is a positive health indicator? Answer my question. Which of the following mortality indicator is a positive health indicator? Answer my question. Good. Which of the following mortality indicator is a positive health indicator? Answer is life expectancy. Don't make this mistake in the exam. So tell me again, true or false. Life expectancy is a mortality indicator. True or false. Life expectancy is a mortality indicator. True or false. Life expectancy is a mortality indicator. True or false. True. Correct. Very good. The second mortality indicator is crude death rate. Means how many are dying in the population. Risk of death in a given population. Write the words properly. Risk of death in a population. Highlight these words. Risk of death in a population. So what will be the formula if I write like this? Risk of death in a population. If I use this word, what will be the formula according to you? What will be there in the numerator? What will be there in the denominator? Just by looking at this, you can make the formula out of this. What will be there in the numerator? What will be there in the denominator? Tell me good. What will be there in the numerator? What will be there in the denominator? Yes, correct. Numerator will be deaths. Yes, sir, correct. What will be the denominator? Deaths in 1 year. Okay, good. What will be the denominator? Very good. Population. What population if I take deaths in the numerator? Deaths during 1 year if I am taking. Deaths during 1 year I am taking. So what should be the denominator? Yes, that should represent the year. That should represent that year properly. So what should be the denominator? Total population or mid-year population? If I am taking deaths during 1 year, what should be the denominator? Total population or mid-year population? So what will be your answer? Mid-year population. Yes, that will be the denominator. Multiply with 1000. On what date we calculate mid-year population? Yes, very good. On what date we calculate mid-year population? On what date we calculate mid-year population? July 1st. Yes. Mid-year population is on July 1st. In between the year. In between the year. What is the recent infant mortality rate of our country? See the notes. Turn the page back and answer my question. Good. What is the recent infant mortality rate of our country? What is the recent infant mortality rate of our country? 28. Very, very good. Very good. 28 is the answer. What is the recent crude death rate? What is the recent crude death rate? 6 per 1000 mid-year population. This is the recent crude death rate of our country. 6 per 1000 mid-year population. So what is the unit? Listen to the words properly. What is the unit of crude death rate? This is the question what I am asking. What is the unit of crude death rate? What is the unit of crude death rate? What is the unit of crude death rate? पूरा लिखना पड़ेगा आपको. Per 1000 mid-year population. Yes, good. Per 1000 mid-year population. Yes. It is 6 now. How to calculate growth rate? Using crude death rate I am asking. How to calculate growth rate? Very easy question. One more question I am asking. You are given crude death rate. You want one more thing to calculate growth rate. How to calculate growth rate of the population? Easy question. How to calculate growth rate of the population? How to calculate growth rate of the population? We have to subtract, yes, we have to subtract two things. Crude birth rate minus crude death rate. This is the formula. Continue. Growth rate is subtracting two things. Birth rate minus death rate. If birth rate is given, this is the addition to the population. Death rate will be the deletion. Crude birth rate is addition. Crude death rate is deletion. So if birth rate is more than death rate, if birth rate is more than death rate, population will increase. Growth rate is positive. True or false? Very easy basic question. If birth rate is more than death rate, population will increase. Growth rate is positive. True or false? True statement. Yes, true statement. Because this formula is like this. This formula is known as natural increase method. Natural increase method is used to estimate growth rate of the population. True or false? See the next question. Natural increase method is used to estimate growth rate of the population. True or false? Growth rate of the population. True or false? Highlight this word, natural increase method. Very, very important point. And whenever you are calculating growth rate is expressed in percentage. Growth rate is expressed in percentage. Per 100 you have to express. Write this point also. Growth rate is expressed in percentage. Take one example now. Take one example. These are the points given to you. Crude birth rate is 20 per 1000. Crude death rate is 4 per 1000. Take this example. Crude death rate is 4. Crude birth rate is 20. So what will be the growth rate? Use some maths, very basic. Express it in percentage I am telling. Already written properly. Express it in percentage. Yes, 16 per 1000, but percentage it is 1.6%. This will be in the option. 1.6% is the answer. 16 per 1000, na? But we express it in percentage. Answer is this. This will be there in the option. 1.6%. And using growth rate, we can also estimate population doubling time. Write this formula also. Malthusian model will estimate population doubling time. The formula is already given to you. 70 by growth rate. This was devised by Malthus. He was a famous demographer already established, and there is a formula given by Malthus that will be used to estimate population doubling time. If growth rate is more, population doubling time will be less. True or false? See the words properly. If growth rate is more, population doubling time will be less. True or false? Yes, true statement. Means resources, we need to maintain it properly, because growth rate is more, population doubling time will be very, very less. So we have to maintain the resources properly. We have to maintain the resources properly. That is what I wanted to say. If growth rate is 2%, population doubling time is how much in years? I am telling. Tell me, if growth rate is 2%, I am giving very basic example which was asked in the exam. If growth rate is 2%, yes, good. How many years it will take for the population to double? 70 by 2. Answer is 35 years. Write this example. Good. Population doubling time we can estimate by using growth rate. 70 by 2. 35 years. Who gave this formula? Repeat the words. Who gave this formula? Malthus. Malthusian model is used to estimate population doubling time. Malthusian model is used to estimate population doubling time. So we are discussing crude death rate now. All these points what you are writing, is under crude death rate only. Now see the words properly. Crude death rate is age or sex specific. True or false? Answer my question. Crude death rate is age or sex specific. True or false? See the words properly. Crude death rate is age or sex specific. True or false? False statement. It is not specific. It is for the whole population what you are estimating. It is not at all specific. So write this word. It is the simplest indicator of mortality, not age or sex specific. Write this. Crude death rate only, we are writing all these points. It is the simplest indicator of mortality because crude oil, it is for the whole population. It is for the whole population. It is not age specific. It is not sex specific also. So we have finished 2 mortality indicators now. Tell me, what are the 2 mortality indicators we have finished? Type it in the chat box. Type it in the chat box. Good. 2 mortality indicators what we have finished. Yes, crude death rate and life expectancy. Good. Very good. Yes, good. Now tell me, if I want to know which age group is having more risk of death, what indicator has to be used? If I want to know which age group is having more risk of death, what indicator I have to use? Very easy question I'm asking. What indicator we need to use? Specific death rates. Yes, give number 3. Specific death rates, like age specific you can calculate. Sex specific death rate you can calculate. Disease specific death rate you can calculate. Write down the formulas. First is age specific death rate. Second is sex specific death rate. Third is disease specific death rate. Here you make mistakes in the exams. Write down 1, 2, 3. Age specific death rate. Good. Sex specific death rate and disease specific death rate. 1, 2 and 3. So 3 things you should know. Let us discuss this one by one. Age specific death rate, sex specific death rate. The third is disease specific death rate. Disease specific death rate. So now number 1 is age specific death rate. So if I want to know risk of death in this age group, 5 to 10 years. Write down the formulas. Denominator will be how many are there in that age group, mid-year population of 5 to 10 years. Numerator is deaths within 5 to 10 years. Deaths within 5 to 10 years. Multiply with 1000. Multiply with 1000 means every age is having its own risk of death. You are calculating risk of death in that age group, means age specific death rate will indicate high risk age groups for mortality. True or false? Will indicate high risk age group for mortality. True or false? High risk age group for mortality. True or false? True statement. Very good. So write down the words. Means you are cutting the whole cake into so many pieces. Which age group is having more risk of death you are estimating? Every age group will be telling the risk of death in that age group. Write down this point. High risk age for mortality. What indicator is used? Answer is age specific death rate. The whole cake you are cutting into so many pieces. That means when you bring all the pieces of cake together, what indicator will get? Very easy question I'm asking. If you are bringing all the pieces of cake together now, what indicator will get? If you bring all the pieces of cake together, what indicator will get? Crude death rate. Yes, very good. Crude death rate will be getting. That means there are so many pieces, age wise you are cutting. If I want to cut the cake into two pieces, male and female, for males, for females, what indicator will get? Answer my question. If I want to cut the whole cake into two pieces, for males, for females, what indicator will get? Sex specific death rate. Yes, for males and for females, if I do it is sex specific death rate. Rate number 2. Sex specific death rate for males and for females. Write down the formula. If I want to know for females, mid-year population of females in the denominator, numerator is deaths within females. Multiply the whole thing into 1000. The whole thing into 1000. Usually most of the countries, males will have more risk of death. What can be the reason males will die more? What can be the reason? Don't write, just I'm telling. Usually common sense, most of the countries males will die more comparatively. What will be the reason? Don't say like this, stress, matlab males like so and so and all. Don't, matlab simple, huh? Good risk factors are very high. Risk factors are very high. Smoking, alcohol, okay. Why should males have all the fun? Like that will be telling, na? Why should males have all the fun? Heartbreaking and all, okay. Devdas, you're telling, no? Why should males have all the fun? That can be the reason. So, sex specific death rate will indicate high risk sex for mortality, true or false? Very easy question I'm asking. Sex specific death rate will indicate high risk sex for mortality, true or false? True or false? True or false? Yes, true statement. True statement. Correct. True statement. So what are the three specific death rates which I made you to write? Age specific, sex specific. What is the third one? What is the third one? Which is very important, repeatedly asked in the exam. One is age specific. Second is sex specific. What is the third one? Disease specific death rate, also called as cause specific death rate. Disease specific death rate, also called as cause specific death rate. Here you make mistakes in the exam. That is why I am telling again and again. Highlight this formula. Disease specific death rate of tuberculosis, for example. Numerator is deaths due to TB. Denominator is anyone in the class. If you tell the denominator properly, I'll be giving one chocolate for you. Chocolate means all these things are virtual only. Chocolate, dairy milk, cake, vanilla cake or whatever. I'll be giving one basic small chocolate for you. If possible later we can meet and we can give chocolates in real also. But as of now, it is virtual chocolate only. Where is that chocolate? I'm searching chocolate. I'm not getting that. Okay, emoji, chocolate. Who is writing? Nobody is writing. That is why. Once you write the exact answer, I'll be giving the chocolate for you. Not cases. Yes, Dr. SK got the chocolate for this. It is mid-year population. It is mid-year population. Write the denominator. Don't write cases, don't write total deaths. It is just mid-year population. It is just mid-year population. Here you make mistakes in the exam most of the times. That is why I'm telling. Just mid-year population. Mid-year population. Multiply with 1000. So what is the denominator of disease specific death rate? Answer my question. What is the denominator of disease specific death rate? Yes, good. What is the denominator of disease specific death rate? Mid-year population. mid-year population. If I write cases, it will become different. Cases is totally different thing. If I write cases, then it will become what? I'll be discussing later. If I write cases, it will become what? Case fatality rate. Yes, it will become case fatality rate. Don't write cases in the denominator. Don't write cases in the denominator. Got my point? So did you copy all the formulas? Tell me yes or no. Did you copy all the formulas? Tell me yes or no. Did you copy all the formulas? Tell me yes or no. So now write fourth mortality indicator. So before that, tell me true or false. Listen, specific death rate like age and sex specific death rate can indicate risk of death in different subgroups. Can indicate risk of death in different subgroups. True or false? Specific death rate can indicate risk of death in different subgroups. True or false? True statement. Highlight the keyword. Highlight this word subgroups. Yes. Highlight this keyword subgroups. Specific death rate will indicate risk of death in different subgroups. True or false? True. Like which age group is having more risk, which sex is having more risk, like that we can estimate. So write this point. Specific death rate can indicate risk of death in different subgroups. So we have finished 3 mortality indicators. Number 1, 2, 3. Tell me all the mortality indicators together. Tell me all the mortality indicators together. Life expectancy, yes. Number 2, crude death rate. Number 3, specific death rate. Number 3 is specific death rate. Total 3 mortality indicators we have finished. So fourth one is proportional mortality rate. Very, very important. Proportional mortality rate. I want to know the contribution. For example, contribution of tuberculosis. Proportional mortality rate of TB. Numerator will be deaths due to tuberculosis. What is the denominator? Now tell me, easy question I am asking. What will be the denominator? Those who will answer first will get one cricket bat from my side. Cricket bat I am searching. Those who are answering first will get one cricket bat from my side. Bat के साथ ball भी mega. Yes, correct. Total deaths in the denominator. Total deaths due to all the causes. Total deaths due to all the causes. Remember this word. So numerator is deaths due to tuberculosis. Denominator is total deaths. Means that will indicate contribution of tuberculosis in total mortality. We express it in percentage. So listen to the words properly. That will indicate, yes, contribution of tuberculosis in terms of total mortality. Tell me true or false. That will indicate contribution. In the total mortality part. How much TB will contribute? Tell me true or false. Because we express it in percentage. Proportional mortality rate, now we express it in percentage. 10%, 20%, like that we express. Now if I ask questions like this, out of 200 deaths, 20 died due to TB. Listen to the words properly. Out of 200 deaths, 20 died due to TB. So what is the contribution of tuberculosis? Out of 200 deaths, 20 died due to TB. What is the contribution of tuberculosis? 10%. 10%. What image you can use to represent this? Image I am asking. Out of 200 deaths, 20 died due to tuberculosis. Proportional mortality rate is 10%. Yes, what image you can use? Pie chart. Make one pie chart. Yes, good. 10%. Because it is proportion what you are representing, na? So contribution of TB is 10%. Make one pie chart. Now tell me, what is this portion? Deaths due to accidents, true or false? The other side I'm asking. Deaths due to accidents, true or false? Deaths due to accidents, true or false? False. Deaths due to other causes. Deaths due to other causes. Easy question. But still you make mistakes in the exams. That is what exam is all about. Deaths due to other causes. Deaths due to other causes. Correct. So make one pie chart and write this. They'll ask very basic things. You are making mistakes. That is where they are asking again and again. Make one pie chart. Remaining 90% is due to other causes. So how much was the contribution of TB in this? How much was the contribution of tuberculosis? How much percent I am asking? 10%. What is the use of proportional mortality rates? I'm asking one question like this. What is the use of proportional mortality rate? If I'm a public health, PSM public health expert, I want to know something related to a disease. I will be calculating proportional mortality rate. What is the use of proportional mortality rate? Yes, contribution. Understood. Okay, understood. The word contribution. Yes. Burden. Sai Shri. Very good, beta. Good. Burden. Yes. It will indicate burden of a disease, magnitude of mortality. Write this word. Proportional mortality rate can indicate which disease is contributing more. It will indicate burden of disease, true or false. Burden of disease with respect to mortality, I am telling. What my point? Burden of disease with respect to mortality. Tell me true or false. Burden of disease with respect to mortality. Tell me true or false. True statement. That means whatever the disease which is contributing more can become the most common cause of death in that population, true or false? Whatever the disease which is contributing more can become the most common cause of death in that population. Like most of the times, they'll be dying due to heart attacks. Most of the times, they'll be dying due to heart attacks, cardiovascular disease. So, what indicator is used if I want to know the most common cause of death in the population so that I can allocate the resources? What you are telling is correct. I can give more importance to that disease. What indicator I need to calculate if I want to know most common cause of death? What is your answer? What indicator I want to know if I want to calculate most common cause of death? Your answer will be proportional mortality rates. Yes, very good. Proportional mortality rates. Very good. Correct. Proportional mortality rates. So total 4 mortality indicators we have finished. 1, 2, 3, 4. 1, 2, 3, 4. Highlight these words. I'm telling highlighter again and again because there is some importance. Later when you revise, it will become very easy for you if you are using highlighter within the class only. Within the class. I want to know severity of disease. How dangerous is the disease in terms of mortality, I'm telling. What indicator is used? I want to know severity of disease in terms of mortality. What indicator is used? Severity of disease in terms of mortality. What indicator is used? Case fatality rates. Good. Case fatality rates. Number 5, mortality indicator. Case fatality rate of Japanese encephalitis. What is the numerator? What will be the denominator? Answer my question. What will be the denominator? The numerator is deaths. What will be the denominator? The numerator is deaths. What will be the denominator? Cases. Yes. Case fatality. The word says case fatality. Na? It is a proportion. Always remember. Expressed in percentage. Out of total cases, how many died? Out of total cases, how many died? The word says, na? Yes. Case fatality. Correct. What you're telling is 100% correct. Case fatality. So the denominator will be cases. Numerator will be death. Within cases, how many are dying? Case fatality rate. It is expressed in percentage. Multiplier is 100. If I am telling like this, 200 cases, 60 died. 200 cases, 60 died. 200 cases, 60 died. So what is case fatality rate of that disease? Very easy question. Just simple basic maths I'm telling. Out of 200 cases, 60 died. Case fatality rate will be 30%. What image you can use to represent this? What image you can use to represent this? Yes, correct. Pie charts. Yes, sir. We can use pie chart. Write the examples. Out of 200 cases, 60 died. Case fatality rate is 30%. What will be the remaining portion? If I am telling what is this 70%? 70% is survival rate. True or false? 70% is survival rate. True or false? 70% is survival rate. True or false? True, because if case fatality rate is 30, opposite will be 70. That is what they want to say. If it is 20, that is 80. If it is 30, that is 20. Will you agree on this point? Tell me yes or no. 30, 70. Yes, opposite proportions. Opposite proportions. That means the case fatality rate will indicate severity of a disease. Tell me true or false. Case fatality rates can indicate severity of a disease. True or false. Case fatality rates can indicate severity of a disease. True or false. Killing power of a disease. True or false. Very good. Tell me the uses of case fatality rate. You only type it. Tell me the use of case fatality rates. Yes. Like we have discussed the use of proportional mortality rates. Na? Tell me the uses of case fatality rates. Severity of a disease. Virulence of an agent. Yes. Killing power of a disease. Write the words properly. Severity, virulence. Very good. Virulence. Yes. I want the keywords. Highlight the keywords. Yes. Good. Severity, virulence. Killing power of a disease. Yes, correct. All these points are 100% correct. Killing power of a disease. Which disease is having highest case fatality rates? If I am asking direct question to you, which disease is having highest case fatality rates? Rabies. Yes. Highlight the case fatality rates of these four things which are repeatedly asked in the exams. Rabies 100%, yellow fever 80%, Nipah 60 to 70%, Ebola 40 to 50%. So Nipah infection is more fatal than Ebola. True or false? See the words properly. Nipah encephalitis is more fatal than Ebola. True or false? See the words properly. Nipah infection is more fatal than Ebola. True or false? True or false? True statement, because when I teach Nipah, when I teach encephalitis, Ebola and all those incommunicable diseases, you have to know these points. You have to know these points. They'll be asking questions like this. This is the easiest question. Rabies is having case fatality rate of 100%. Very recent FMG questions. So just listen now. For NEET, they'll make it more difficult slightly. Nipah is more fatal than Ebola. Like that they'll be asking question, or they'll be asking what is case fatality rate of Ebola hemorrhagic fever. What is the answer? What is the case fatality rate of Ebola hemorrhagic fever? What is the answer? 40 to 50%. That means case fatality rate is used for acute infections or chronic infections. Case fatality rate is used for acute illness or chronic illness. Acute illness or chronic illness. Acute, yes, very important. Chronic diseases we don't calculate because it is long standing. disability will be more rather than mortality part. Na? So total 5 mortality indicators we have discussed. Tell me one by one. Life expectancy, crude death rate, specific death rate, proportional mortality rate contribution, virulence, severity, case fatality rates. Total 5 mortality indicators which are very important previous year topics for you. Come to 5-year survival rate in this chapter. One more subheading you write, 5-year survival rate. Separate heading you write. Make one separate heading, 5-year survival rate. Very good. So what you are typing is correct. Make subheading 5-year survival rates. So 5-year survival rates will indicate what? When you are talking about cancer, I am telling, you are having a cancer patient. What is the use of knowing 5-year survival rates? What it will indicate? This is my question, direct. What your 5-year survival rates will indicate? Yes, correct. Prognosis for a patient. Prognosis for a patient. Cancer prognosis usually, yes. 5-year survival rate will indicate prognosis. Stage 1, stage 2, which is more dangerous. Like that. Comparatively, it will indicate prognosis. So, what indicator is used in estimating prognosis for a patient? Usually, cancer patient we give. What is your answer? What indicator is used to estimate prognosis or assess prognosis for a cancer patient? So, what is your answer? 5-year survival rates. 5-year survival rates. 5-year survival rates can also indicate which treatment is better, whether radiotherapy is better or chemotherapy is better. By using radiotherapy or chemotherapy, which is better, 5-year survival rates can indicate which treatment is better. Standards of treatment, true or false. Like for example, radiotherapy versus chemotherapy. Just basic example what they are asking. Radiotherapy versus chemotherapy. 5-year survival rate is using radiotherapy is 70%. Using just chemotherapy is 30%. So which treatment is better? Tell me. Which treatment is better? Very basic example I am telling. This was again a repeat question. A study was done in cancer patients using radiotherapy and chemotherapy. Yes. Using radiotherapy, if the 5-year survival rate is more, 70%, that is comparatively better. Like this question was framed. Which of the following is used as an yardstick to compare standards of treatment? What is your answer? Usually in cancer. Again, I'm telling in terms of cancer only. Which of the following is used as an yardstick, means a measurement method for comparing standards of treatment? What is the answer? 5-year survival rate. Yes, correct. 5-year survival rate. Very good. So these are the questions on 5-year survival rate. Read the example. Radiotherapy, chemotherapy. 70%, 30%. Radiotherapy is better comparatively. Means after 5 years, when you check the patients, almost 70 will survive in radiotherapy. How many will survive if you use chemotherapy? Tell me. Out of 100 I am asking. After 5 years, how many will survive if you use only chemotherapy? Out of 100 I am asking. Good. How many will survive? 30. So which is better? Radiotherapy is better. Radiotherapy is better. Good. Radiotherapy is better. Come to this word, morbidity indicators. Next point. Next subheading you write separately. Morbidity indicators. There are two things in morbidity. One is incidence. The second is prevalence. One is incidence. The second is prevalence. Can you define incidence for me? Definition I made you to write there only. Can you define incidence? Can you define prevalence for me? Give numbers 1, 2. 1 is incidence, 2 is prevalence. I want to know morbidity pattern of a system. Yes, good. New cases. with respect to time. Very good. New cases with respect to time. So make subheading incidence. Write the first point. New cases with respect to time. So that means, very good. That means what I'm telling is incidence will tell the risk of developing disease in the community. True or false? Incidence will indicate the risk of developing disease in the community. Any new disease, any new outbreak happens. Incidence will tell what is the risk of developing disease in the community. True or false? Yes, true statement. See the words what I'm using. Risk of developing disease. Highlight the keywords. Highlight all the keywords. Highlight this word new cases. Highlight this word time. Highlight this word risk. Risk. Very, very important words I'm telling again. These are the clues in the exam when you are marking. So first write all these points. Then I'll tell how to calculate what is the formula. Risk of developing disease. That means you'll be starting with population initially. Population at risk. Numerator will be new cases. How many will develop disease? So what is the denominator and what is the numerator? So what is the formula for incidence? What is the formula for incidence? New cases divided by population at risk means initially we start with population at risk. Highlight the denominator properly. Within that, how many new cases will develop? How many new cases will develop? So you have to give some time. After certain time, how many new cases will develop? That means what studies will be used to estimate incidence? Cross-sectional study or cohort study? Yes, good. Direct question I'm asking. What studies are used to estimate incidence where follow-up should be done? Cohort study, because for incidence calculation follow-up is necessary. For incidence calculation follow-up is necessary. Use some common sense. Those who are typing cross section, you are doing the grave mistake. Again I'm telling, there is nothing in that. Cross section is at one point of time. What cross section will give? Tell me. Now tell the answer. What cross section will give? Already you know the definition. That is why I'm asking. Very good. What cross section will give for you? At one point of time, if you are doing the study, what cross section will give? Prevalence. What cohort studies will give? Tell me again, I'm asking. Don't make this blunder. What cohort studies will give? Where you do follow up, it will give incidence. Cohort studies means we'll be doing follow up. Again, study design separately I'll be teaching. If you are making mistakes in the classes, good. Because you won't repeat that mistakes in the exams. That is what is very important. Answering the question, making mistakes is a part of the learning process, na? Because you won't repeat that. You won't repeat that. Yes, very good. So for example, I'm telling, take this question. Population is 5,000. 500 are having myopia. After 1 year, 90 new cases developed. Multiplier is 1000. They've asked in the question. The multiplier is 100. If they'll be mentioning in the question only what you have to multiply with. What will be multiplying here in this question? What is the multiplier? In this question, what will be the multiplier? 1000. Yes. If they mention per 100, you have to multiply with 100. It's not always 1000. Depending on the question, when you solve the questions. Good. Very good. Yes, correct. Calculate incidence. Calculate incidence. How much you are getting? 10, 20, 30, 40. These are the options. 10, 20, 30, 40. Very good. Do it properly. Not 20%. Yes, 20 per 1000. Yes. How you got 20? Those who are getting 18 is you're doing the basic mistake. If 500 are already having disease, If 500 are already having disease, so what is the population at risk now? Tell me. 500 are already having disease. What is population at risk? 500 are already having disease. What is population at risk? 500 will be subtracted. 500 will be subtracted. 500 will be subtracted. So 4500. Within 4500, 90. So now tell the answer. Multiply with 1000. How much you are getting? 20 per 1000. 20 per 1000. So if 500 are already having disease, subtract them. Why we are subtracting 500? Answer my question. Why we are subtracting 500? Very basic, because the formula is like that. Why we are subtracting 500 already having disease? So they are not at risk. They are not at risk. So what will be the denominator? What will be the denominator? Population at risk will be the denominator. So people already having disease are not at risk. People already having disease are not at risk. So 4500, if you have 90 will be in the numerator. So answer is 20 per 1000. If I give it in option like this, 1 per 100, 2 per 100, then what is your answer? If I give like this, 1 per 100, 2 per 100, 3 per 100, 4 per 100, then what is your answer? Simple maths I am asking. The options like this, 1 per 100, 2 per 100, 3 per 100, 4 per 100, what is your answer? 2 per 100. Very good. So what was the answer for this question? I want you to type. I want you to highlight this. I want everyone to type the answer for this question. 500 are already having disease. Yes. It is why we need to subtract. This is first question. This is question number 1. How to calculate incidence. The denominator is population at risk. Take one more question. 100 painters are followed up for 2 years. 100 painters are followed up for 2 years. 20 new cases of dermatitis developed. Write this. 20 new cases of dermatitis developed. 20 new cases of dermatitis developed. Calculate incidence per 100 person years. First copy the question, then I will tell how to calculate. Calculate incidence per 100 person years. Possible some students can do this also, but I will be telling how to do. Yes, good. I will be telling how to do. Some students they'll be doing before only. What is the answer? First copy the question. Aram se copy the question. Denominator is total population into time. Denominator is total population into time. Numerator is new cases. Write the formula. Numerator is new cases. Multiply with 100. Because they are asking 100 person years. Multiply with 100. They are asking 100 person years. Now tell me how many painters are there in total? Tell me how many painters are there in total? 100 painters. How many years of follow-up you are doing? Tell the answer. How many years of follow-up you are doing? 2 years. 2 years. 2 years. How many new cases developed? 20. How many new cases developed? 20. So now you calculate. How much you are getting? 10 per 100 person years. 10 per 100 person years. This is the way to calculate answer for this question. What is the denominator? Tell me, what is the difference between previous question and this question? What is the denominator here? Directly I am asking. What is the denominator? Yes, good. What is the denominator? Population into time, because they are asking person years, na? They are asking person years. Yes, population into time. How much you got? How much you got the answer? 10 per 100 person years. First copy the formula. Copy the formula. Use that formula. Substitute in the question. Yes, then you'll be getting the answer as 10. Hope everyone got the answer as 10. Na? Once you solve the question in the way I'm telling, it is very easy. Direct answer you'll be getting. Or if you want to solve questions like this, then also you can do it like this. 100 twos are 200 person years. Risk is 20. Will you agree on this? 100 into 2. 200 person years. Risk is 20. So therefore, for 100 person years, what will be the risk? This is the question. I'm making it more easier for you. 100 twos are 200. For 200 person years, the risk is 20. The risk is 20. Therefore, for 100 person years, direct answer, what will be the risk? This is the easiest way to calculate. Na? Same thing you'll be using formulas also, that will be very lengthy, but this is very easy to calculate. 100 twos are 200, risk is 20. For 200 if it is 20, for 100 it is 10. This is very easy to calculate. So got my point? So we have discussed two calculations on incidence. Now tell the answer. Incidence is obtained from follow-up studies. True or false? Again the easiest question I am asking. Incidence is estimated from follow-up studies. True or false? Incidence is obtained from follow-up studies. True or false? True means from exposure you will start, you will go towards outcome. That is what I wanted to tell. Use of incidence. Write this word. Use of incidence. We'll be studying etiology, causality. Starting from exposure, we'll go towards outcome. Means nothing but risk factor to disease. Exposure to outcome. Tell me yes or no. Exposure to outcome. Risk factor to disease. Tell me yes or no. Follow-up studies, na? Cohort studies. Like you'll be starting from smoking. Then you'll be following them up. How many new cases of cancer will develop? So that is what you are studying. Risk, causality, etiology. So all these things will be done in what studies? Cross-sectional studies or cohort study? All these things will be done in what study? Cross-sectional study or cohort study? Cohort study. We start from exposure, go towards outcome. Yes. What is this sequence known as? Anyone? Good. Those who tell first will get one vanilla cake from my side. Already written. Those who will tell first will get one vanilla cake from my side. This sequence is called as what? Temporal association. Temporality. Very good. SK. Temporality. I want new students to answer my question. If the old students are answering, they won't get anything. I want all my new students to answer this question. Good. So you'll be getting this vanilla cake. One layer of cream is there. Some strawberry is going on that. It's looking good. Temporality is very important word for me. Starting from exposure, you'll go towards outcome. If I start from alcohol, if I go towards liver cancer, what is this sequence studied called as? Temporal association. What studies will be done to prove temporality? Answer my question indirectly. What studies will be done to prove temporality? Cohort study. Yes, good. Temporal association is most important criteria to prove etiology. Most important criteria to prove etiology. Yes, correct. Write this word. Temporal association is most important criteria to prove etiology. If I want to prove alcohol is the cause of liver cancer, what is the most important criteria we need to establish? What is the answer? I want to prove alcohol is the cause of liver cancer. What is the most important criteria I need to establish? What is the most important criteria I need to establish? So what is your answer? Temporal association. Yes, good. T for temporal association. So these are all the questions on incidence. What is important for you? Did you note all the points? Tell me yes or no. Did you make a note of all the points which has been discussed? Tell me yes or no. What is existing cases at one point of time? Tell me. What is existing cases at one point of time? What is existing cases at one point of time? Prevalence. Very good. Right, next point. Prevalence. Existing cases at one point of time. When you go to a class, if you're doing a study now, how many are having refractive errors? What study is that? What you will get? Direct question I'm asking. Already you know the answer. For so many times I've used that word. Prevalence. Existing cases at one point of time. Very good. Cross section. Out of 200 students, 20 are having refractive errors. Right, next point. Write the definition. Existing cases at one point of time. Out of 200, 20 are having refractive errors. What you will get out of this study? Can you calculate incidence? Tell me yes or no. Can you calculate incidence? By this study, is it possible to calculate incidence? Yes or no? No, you cannot. Only existing cases what you are counting. Prevalence 10%. What image you can use? What image you can use to show this? Pie chart 10%. Pie chart 10%. Good. Why pie chart? Because prevalence is an example for rate or proportion. Already we have given the examples. Prevalence is an example for rate or proportion. Proportion. So we can use pie charts. P for prevalence. P for pie charts. P for proportion. Very good. P. Prevalence, pie charts, proportion. What is this study done at one point of time where there is no follow-up? What is this study which is done at one point of time? There is no follow-up, called as cross-sectional study. So prevalence is obtained from cross-sectional study, indicating burden. How many are having disease? Cross-sectional studies can indicate risk of developing disease. True or false? Good. Cross-sectional studies can indicate risk of developing disease. True or false? Cross-sectional studies can indicate risk of developing disease. True or false? False. Cross-sections can indicate only burden. What is morbidity indicator used to express burden of a disease? See the words properly. What is morbidity indicator used to express burden of a disease? What is your answer? Morbidity indicator to express burden of a disease. What is your answer? Prevalence. Good. Mortality indicator is different. Here it is morbidity indicator. Again you are making the mistake. Mortality indicator is PMR. but morbidity indicator is prevalence. So don't make mistakes. Don't tell whatever you want. So now tell the answer. Prevalence depends on two things. Prevalence depends on two things. Incidence and duration. Write this equation PID. 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 Incidence into duration. Incidence into duration. What does it mean? If I am showing like this, what does it mean? If I am showing this image, very basic image, don't write this image in the notes. Toilet, bathroom, tub and all, tap and all, don't write all this. New cases are adding on, new cases are going inside. Prevalence will increase. Tell me yes or no. If new cases are getting added, so prevalence should increase. Tell me yes or no. Simple, yes, but duration is also important. If there is cure and death, these two things will reduce prevalence. Tell me two things which will reduce prevalence, I am asking. Two things which will reduce prevalence. Naturally, either they will get cure or they will get, means they will die. Yes. So that means what I am telling, there is inlet and there is outlet. Outlet means two things which will reduce prevalence. Which will reduce prevalence. Yes. Death and cure. Write this image. One is inlet, outlet. The center is reservoir. Write this in the notes. Good. एक inlet हो गया, एक outlet हो गया ना. Death है, cure है. These two things will reduce prevalence. These two things will reduce prevalence. That means what I wanted to tell is, listen, prevalence will be more for acute illness or chronic illness. Prevalence will be more for acute illness or chronic illness. What is your answer? Yes, very good. Prevalence will be more for acute illness or chronic illness. Chronic illness. Give some examples for chronic long-standing illness where the prevalence is very high. Give me some examples for long-standing illness. First copy the image. I'll make you to write all the points. First copy the image. Yes, good. Hypertension, diabetes, like that. Write down short duration, long duration. Make a table. Convert the image into a table. Short duration means acute illness. Give some examples for acute illness which is easily curable, highly fatal. Answer my question. Which is easily curable, highly fatal. Give some examples for acute illness I am asking. Easily curable. Yes, correct. Common cold. Yes, coryza. Yes, good. Common cold or highly fatal. Rabies. These diseases which are acute will be having more prevalence or less prevalence? These diseases which are acute will be having more prevalence or less prevalence? Less prevalence. Yes, good. Less prevalence. But long-standing illness where there is no death, no cure will be having more prevalence. Like when you do a cross-sectional studies, it is easy to identify acute illness or chronic illness. This is my question indirectly. If you are doing a cross-sectional study, which is easy to identify? Acute illness or chronic illness? Chronic illness. Yes, good. It is easy to identify chronic illness. Chronic illness. Write down the first point. Common cold is having high incidence but less prevalence. What can be the reason? Tell me. Common cold within a year you'll have 3-4 times usually. Common cold within a year you'll be having 3-4 times. So high incidence but less prevalence. What can be the reason? What can be the reason? Short duration. Yes, good. Because they recover better. Short duration recovery is high. Acute illness. Correct. Whatever you're telling is correct. 100% good. Short illness. It is easily curable. Duration is less. That means whenever you are doing a cross-sectional study, see the words properly. Whenever you are doing a cross-sectional studies are preferred for acute illness or chronic illness. See the words properly, what I am using. Cross-sectional studies are preferred. Clinically, we can do it for both, but preferred I am asking. Cross-sectional studies are preferred for chronic diseases, yes, because easy to identify. Agree on this? Maybe repeat question. All these are very important lines, very important points. That means chronic illness like diabetes, hypertension, these things will be there. Na? They'll be having high incidence or long duration. What is your answer? What is the reason why they have more prevalence? What is your answer? High incidence or long duration? Duration, very good. Once they come, it will stay with you. There is no cure, no death also. Write this word. Chronic illness will have more prevalence. Answer is because of long duration. Because of long duration, correct. That means prevalence does not depend on duration of disease. True or false? See the words properly again. Prevalence does not depend on duration of disease. True or false? Prevalence does not depend on duration of disease. True or false? False. It depends. That is why what is the equation what we discussed? I want everyone to type this equation. What is the equation which I discussed? PID. PID. Yes. Pelvic inflammatory disease. Remember the mnemonic. Prevalence depends on two factors, incidence and duration. So everyone, did you note all the points on this? Tell me yes or no. I'll make you to write some other points on the same thing. First tell me whether you note these points or not. Highlighter, possible, use it. If you don't have a highlighter, as of now you just underline this. Then later you can use the highlighter and highlight it later. Take this question, number 1, on prevalence only. A new effective treatment for cancer is invented. Like if you are putting a surgical intervention, if you are giving a cure, effective means cure. Cancer is non-communicable disease. So now tell me, incidence will decrease because of this. True or false? Incidence will decrease because of this intervention. True or false? First intervention, write down. A new effective treatment for cancer was invented. Incidence will decrease. True or false? False. Incidence, no change. But what happens to prevalence? Tell me. You are not preventing anything, so incidence will not change. Very good. But prevalence will come down. You are curing those who are already having disease. Incidence will not change because it is not preventing anything. If I am putting any preventive intervention, then it is a different concept. Na? Yes, very good. Prevalence will decrease because it is curable intervention. If I change the words like this, a new treatment for cancer, prolonging the survival, but no cure. For anything like you are putting chemotherapies, which is just prolonging the survival. You are making the patient to live with the family. You are not related to cure. You are not giving any cure to the patient. Now tell the answer. What will happen? Very important question. Question number 2. Incidence will remain same. Very good. Prevalence will increase. Incidence will be same. Prevalence will increase. Why? What is the reason why prevalence will increase? Tell me. What is the reason why prevalence will increase? Yes, correct. What is the reason why prevalence will increase? You are making the patient to live for a longer duration, prolonging the survival. Yes, this is the word. Duration is increased. Duration is increased. Yes, correct. Very good. You're making the patient to prolong for a longer, like living without any death. So incidence, no change. Why incidence will not change in both the question I'm asking? Why incidence will not change? Why incidence will not change in both the question? Because you are not preventing anything. So question number 1, prevalence will decrease. Question number 2, prevalence will increase. Good. Just copy these 2 questions. Yes, good. We'll be giving third question now. First, note these questions. Good. It is not preventing anything. Correct. Now tell if I treat a communicable disease, if there is one more question like this, a new treatment for a communicable disease, if this is the question, like you are treating a case of tuberculosis in the family. Now tell the answer. You are treating a case of tuberculosis in the family. So what will happen? You are treating a case of TB in the family. So what will happen? Good. You are reducing the transmission. Good. Yes, very good. You are reducing the transmission. Incidence will also decrease and prevalence will also decrease. Correct. A new treatment for a communicable disease. So both will come down. Why incidence will reduce? Tell the answer. Why incidence will reduce? Tell the answer. There is a case in the family which is a communicable disease. You are treating a case which is a communicable disease. So you'll be reducing the transmission. Why incidence will reduce? Yes, very good. Correct. You are not, there is no spread. Very good. So both incidence and prevalence will decrease. Less people will get disease. Very good. Transmission is reduced. You are reducing the spread. Very, very, very good. Correct. Both will change. Both will change. What will happen if I invent a new vaccine? If I'm telling like this, new vaccine is invented. New vaccine is invented. There is a new prophylactic intervention like chemoprophylaxis vaccine. So what will be the thing? Very easy, direct question I'm asking. A new prophylactic intervention. Highlight the word. Incidence will come down. Okay, sir. Prevention, incidence will come down. If incidence is decreasing, what happens to prevalence in the longer term? What happens to prevalence in the longer term? Like in the future, if there are existing cases, that should also come down because incidence is the inlet part. If that is coming down, prevalence will also decrease. So both will decrease. Tell me true or false. Both will decrease. True or false? Yes. Because if I is coming down, P should also come down. But which is a better measure to assess the impact? Impact of preventive intervention. Which is the better measure? Now you tell the answer. I want to assess the impact of preventive intervention. Which is a better measure? Incidence should come down because prevalence will take some time. So for most of the preventive intervention, I want to assess the impact. Incidence will be a better measure. Tell me true or false. So direct answer, but still I am asking the same thing in true false mode for you. So that you will not forget in the exams. Tell me. Impact of a new preventive intervention is assessed by using the reduction in incidence. True or false? True. Good. Correct. So total 4 things are important. Total 4 things which are important here. Total 4 things which are important. 1, 2, 3, 4. So first 2 questions was on cancer, non-communicable disease. Third question is on communicable disease. Fourth is on preventive intervention. So did you note all the points which has been discussed here? Because these are very important things. repeatedly asked questions, PID related question, prevalence, incidence, duration. Did you note all these points? So now coming to one more topic. So now tell me, what is existing case? Prevalence. What is inlet? Incidence. What is outlet? Two things I want, cure and death. Cure and death. Inlet, outlet. So these are the questions which has been repeated for you in the exam. Good. Inlet, incidence, existing, prevalence, outlet, cure and death. Cure and death. One topic before the break, write down this, very important. Index, combination of indicators. We are using three things in this which are important for you. Human Development Index, PQLI and Multidimensional Poverty Index. Write the words 1, 2, 3. Human Development Index, Physical Quality of Life Index, and Multidimensional Poverty Index. HDI will indicate standard of living. If I want to compare standard of living, I will be using HDI. If I want to compare quality of life, I will be using PQLI. If I want to compare poverty status between the country, I will be using multidimensional poverty index. So now tell the answer. What is used to compare standard of living between two countries? Direct question I am asking. What index is used to compare standard of living between two countries? HDI. Compare quality of life, PQLI. To compare poverty status, now we are using multidimensional poverty index. So we'll be discussing 1, 2, 3 now. Give number 1, 2 and 3. Right, first one. Human Development Index. What is important for a country? How India is better than other country. For example, I'm telling how India is better than other countries, or how America is better than other countries. Example, I'm telling, comparing the standard of living. Comparing the standard of living. So what are the things which are important to compare standard of living? Just basic words you tell. I don't want MCQs. Just I'm telling India country, it is better than Sri Lanka. For example, I'm telling. Now tell, yes, correct. Income, okay, then how to get income? There is a sequence, no? There is a way. If I want now food, very good, impressed, good food. For you, I'm putting one cake. If you want, you can take this vanilla cake. Food, na? Okay, agreed. Okay, food is basic need. Understood. Okay, good. Education, very good. To earn some income, we need education. Yes, good. Education, knowledge, education, correct. Food is not considered. Yes, food, clothes, shelter, all these are basic needs. Knowledge, yes, good. Knowledge. Write down the words. 3 dimensions are important in HDI. Knowledge, income, longevity. KIL. Write the words properly. Knowledge, income and longevity. Kill is the mnemonic. 3 dimensions we consider. And within these 3 dimensions, the indicators used are important. Mean years of schooling, expected years of schooling. We don't consider literacy rate now. Literacy rate is not considered. How many years of schooling? And depending on the dropout rate, expected years of schooling we calculate. Calculation is not necessary. They won't give pen paper. That is why they won't ask difficult calculations for you. Very basic calculations they'll be asking. So literacy rate is included. Now, true or false? Now tell the answer. Literacy rate is included. True or false? False statement. We don't consider literacy rate now. This is very important. We don't include literacy rate now. What is the income parameter we are checking? GNI or GDP? We consider only GDP. True or false? We consider only GDP. True or false? See the next question. we consider only GDP. True or false? False. Not GDP. Not just gross domestic product. We include gross national income, extra income what we get from foreign countries. That is added together. GDP is gross domestic product. What we have, what is the income we generate in our country? Gross domestic product. But extra help what we get from foreign countries is added together to make GNI, gross national income. Gross national income. So what is the income indicator used in HDI? Answer my question. What is the income indicator we used in HDI? Answer my question. Per capita GNI, not GDP. Remember this question. Per capita GNI. Yes, not just GDP. Got my point? Good. The third is longevity. Life expectancy at birth. Life expectancy at birth. So every dimension is given equal 1/3 importance. When you calculate HDI, every dimension is given equal 1/3 importance. Write down this point. Now tell me true or false. Knowledge component is given 2/3 of importance. True or false? Knowledge component is given 2/3 of importance. True or false? Can you hear what I am telling? Knowledge component is given 2/3 of importance. True or false? False. Very good. Every dimension is given how much of importance? Equal 1/3 importance. Equal 1/3 importance. So we calculate average. When you calculate average, it is mean. Human development index is arithmetic mean of all the three dimensions. Think and tell. Those who know, then only they will answer. Human development index is arithmetic mean of all the three dimensions. True or false? False. We calculate geometric mean of all the three indices, not arithmetic mean. So this is the thing what they'll be asking in the exam. Which of the following is geometric mean? Your answer will be HDI. Calculation will be very difficult. They won't ask calculation obviously. Cube root and all, nobody will be having the way. There is no scientific calculator also. So calculation is not asked. If at all it is asked, you will not do it in the exam. That is as simple as this. Simply 1 mark, 1 question they are putting just for the sake of torturing you. Good. They won't ask calculation. HDI ranges from 0 to 1. The recent value of our country has been changed now. It is 0.644. India is ranking 134. This is the recent value. Write down this. India ranks 134. So HDI ranges from 0 to 1. When you calculate, the value for our country is 0.644. Rank 134. So the value is improving, but the rank is coming down because relatively other countries are also improving more, better, in a better way. Like that, they calculate HDI. What is the use of knowing HDI? Quality of life or standard of living? Tell me. What is the use of knowing HDI? I am asking. Quality of life or standard of living? Standard of living between the countries. Good, correct. The value of HDI ranges from 0 to 100. True or false? The value of HDI ranges from 0 to 100. True or false? The value of HDI ranges from 0 to 100. True or false? False. Ranges from 0 to 1. 0 to 1. Good. Which country is rank 1 in HDI? Any guess? As of now also, what is the recent? Which country is rank 1 in HDI? Any guess? They won't ask this, but if you know, it is good. Which country is rank 1 in HDI? Rank 1 in HDI I am asking. Which country is rank 1 in HDI? Switzerland. Yes, now also it is Switzerland only. Yes, good. Switzerland, good. Maybe income, some like other countries, they might be investing. There are some, whatever the reason can be, but rank one is Switzerland. That is what I want to tell. I don't want to dissect much into that. Switzerland, like so and all those things. No? Good. So HDI. What is the mnemonic for HDI? Kill. Knowledge, income, longevity. Knowledge, income, longevity. Kill. I want everyone to type these three things. Basic. Don't make errors in HDI and all those things. Quality of life is given by PQLI, not HDI. Quality of life is given by PQLI. Write down this. Three indicators are there. Infant mortality rate, literacy rate, and life expectancy at age 1. What is missing in PQLI? Tell me the words properly. What is missing in PQLI? What is missing in PQLI? What is missing in PQLI? Very big thing which is missing in PQLI. Income. Yes. Income is not considered. Very, very important point. Income is not considered. We have infant mortality rate. Income is not directly measured. There is nothing like GNI. There is nothing like per capita, GDPs, and all those things are not used. So income parameter we don't measure directly. This will be the question. PQLI there is no income. Income is considered in HDI, but PQLI there is no income. Infant mortality rate is there, literacy rate is there, life expectancy from age 1. Because separately IMR is given importance. Separately IMR is given importance. So from age 1 we calculate life expectancy. That is one thing what you should know. What is HDI? Life expectancy from age 0 at birth only. At birth. Here why we calculate at age 1? Because IMR is given separate importance. IMR is given separate importance. So it is ill. Kill is different. Here it is ill. Kill ill. Like old, we have one Hindi movie long back when we started. Like was teaching since 2012. I'm teaching, and then there are some old movies like in between it used to come like Kill Dil, and all. That was the movie. And Kill Ill, remember the mnemonic. I is infant mortality rate, not income. Not income. So PQLI ranges from 0 to 100. Yes, good. PQLI ranges from 0 to 100. The value for our country as of now it is 70. PQLI ranges from 0 to 1, true or false. The value of PQLI ranges from 0 to 1, true or false. The value of PQLI ranges from 0 to 1, true or false. False. It is 0 to 100. 0 to 100. What index is used to compare poverty status of countries nowadays? One country, one more country, it is more poor than. But the poverty status we need to measure. We need to express poverty status also. What index is used to compare poverty status? Multi-dimensional poverty index, very important. Yes, good. MDPI. Multi-dimensional poverty index. This was the old thing, movie, na? What we are typing, Kill Till. The old things, like Govinda was also there, I think, na? Good. Multi-dimensional poverty index, multi-dimensional poverty index. 3 dimensions are there. Health, education, living standards. Health, education, living standards. See the mnemonic properly. Health, education, living standards. Three dimensions are considered. Within health, 2 indicators are included. Child mortality and nutritional status. Very important. Write this point. Within education, years of schooling and school attendance rate we check. School attendance rate with proxy, without proxy and all, that is not necessary. As of now, just write school attendance rate. Living standards, cooking fuel, water, toilet facility available or not, electricity, floor and assets. You need to mug up these things. There is something called as rectifying, like what you say, roto like that, na? So you have to remember these two things. Like this is one table which we need to ratify, like by heart, na? So health, education, living standards. Health, education, living standards. How many dimensions are there and how many indicators are there? Count the dimensions, count the indicators properly with me. Good. How many indicators, how many dimensions first, then how many indicators are there? 3 dimensions, 10 indicators. Remember the words properly. 3 dimensions and 10 indicators. Very good. 3 by 10. 3 dimensions and 10 indicators. Oh, you are getting 11 mega. Cooking separate, fuel separate you are doing, huh? Whether they are cooking in their house or getting food from outside, Swiggy, Zomato you are doing or what? Huh? Some students will count like this, cooking separate, fuel separate. Whether they are cooking in their house or not. If they get from Swiggy, Zomato means slightly richer. Like that, huh? It is 10 indicators, 3 dimensions. Every dimension is given equal 1/3 importance. Every dimension is given equal 1/3 importance. So relative importance you should know. Now tell me properly, if the health component is given 1/3 of importance, how much child mortality is given? How much importance child mortality will get? Tell me proper, simple, basic maths I'm asking. Very good. Very, very good. How much importance child mortality will get? 1 by 6. Yes, correct. 1 by 6. Here also 1 by 6, 1 by 6. Because total 1/3, na? How much importance electricity present or not will get? See, if this is 1/3, you have to divide it accordingly. Mathematics. How much importance electricity will get? Present or not in their houses. Each and every indicator in living standards will get how much importance? 1 by 18th. Very, very good. Correct. Easy. 1 by 18th. ये भी पूछते हैं आपको, मतलब this is also important. When you calculate multidimensional poverty index, the value range from 0 to 1. The value range from 0 to 1. The recent value of our country is 0.123. Write down the values. The value ranges from 0 to 1. The recent value is 0.123. So the value of MDPI ranges from 0 to 100. True or false? The value of multidimensional poverty index ranges from 0 to 100. True or false? False statement. Good. False statement. Correct. So did you note all the points? The relative importance? Tell me yes or no. We have finished 3 index also. Remember the mnemonic properly. Kill. I want everyone to type these words. Kill, ill, hell. Yes, very good. Kill, ill, hell. Kill, ill, hell. So just in the next session, I'll be finishing this last subheading in this chapter. Last subheading in this chapter. Very good. So we need to give something for this student, na? Shri, for typing this. Human skill, physically ill, poverty is hell, like that, na? Very good. So much of creativity you are putting there. What you want? Something if I want to give, what you want? Good. Shri, very good, beta, good. What you want? Huh? Summary measures of public health. Summary measures of public health. Summary measures of public health. 3 things you should know. Dailies, qualies, and hail. I'll be covering this in the next session after the break. How to estimate dailies. What are the components in disability adjusted life years? How qualities are estimated for an intervention, effectiveness of intervention, and what is the use of health adjusted life expectancy, how it is different, from life expectancy. So as of now, we have finished 4 subheadings. Can anyone type the headings for me? What has been finished, I am asking. Rate, ratio, proportion. That was the basic starting when I did. Next was mortality indicators. Very good. 5-year survival rate. Separately we discussed. Morbidity indicators, where we discussed all the points on incidence and prevalence related questions, how the questions will be framed in the exam. And we also covered the types of index. 3 index, and what are the things what we need to discuss. So this chapter, one more subheading is left in this chapter. This will be the last subheading in this chapter. So we'll be finishing it after the break. Then we'll go to the next chapter. So the chapter number 1 is health indicators. Within health indicators, we are discussing all these subheadings. So the chapter 1 is health indicators. Subheadings will be like this: rate, ratio, proportion, dropout rate. Depending on the dropout rate, expected years will be calculated based on the dropout rates used to estimate expected years. Mean years means on an average how much they will go. But dropout rate will decide how many years they will go in the future, estimated years of schooling when they calculate. So you do one thing, the last subheading in this chapter left that I will be covering after the break. Take a break of 20 minutes. It's 12:10 now. You come at 12:30. The next session will be from 12:30 to 2:30. So 2:30 we'll have lunch. So the next session will be from 12:30 to 2:30. So take a break of 20 minutes. This is the break in between. You can take it as breakfast break or brunch. But usually when you have lunch will be at 2:30. That will be slightly longer break. So take a break of 20 minutes now.